Will volume restoration or fat transfer to my lower face or anywhere in my face make me look heavy? And the answer is no. When done carefully and in experienced hands, it really should just flatter and make us look more model-esque. Particularly the lower face. When someone has hollowness in the buccal area, yeah, we might want to infiltrate some volume, but most of the time we're not augmenting the buccal area. We tend to focus on more of the cheekbone area, underneath the eyes, cheekbones, maybe nasolabial folds, maybe a little bit along the jawline here in what's called the pre-jowl sulcus, or behind the jowl area in what's called the angle or the post-jowl area. In order to straighten that jawline in someone who doesn't have a lot of jowling, then that's acceptable to do. But in all cases, it's intended just to smooth that out, not to bulk out that area and create excessive sort of chipmunk cheek type of appearance, or excessively cherubic or young face, like a baby's face, which is more round in the lower face. So we're looking for more of an early adulthood contour where the definition is in the cheekbone area, and then it's just smooth in this area instead of convex. Hope that helps, and best wishes.